7 News Now begins with 10 minutes of non-stop news.
Managing back pain is taking a new direction thanks to input from doctors and patients right here in our area. The University of Colorado Hospital is on the verge of curing mild to moderate disc degeneration. The results can be nothing short of amazing, as you'll see in tonight's 10-15 difference.
We had the trip to Thailand.
The last thing Kathy Hasselbrook wanted was to miss the full Thailand experience.
And there were some things that I couldn't do, and I was afraid of the long flight.
The elephant ride I was not on.
But that's exactly what happened. Back problems, specifically degenerative back disease, ruined some of her vacation, but convinced her of one thing. She'd finally agree to have disc replacement surgery.
Throughout the years, I've just apparently not treated my back well, and I have the problems now. Besides the back pain very low, it's like you just lost that structure.
Kathy traveled from South Dakota to be part of a clinical trial. Spine surgeons at the University of Colorado Hospital are testing a new model of replacement discs. Those currently used are easily implanted and provide mobility, but this new disc could go one step further.
It also allows a little bit of this sliding or translating motion.
For Kathy, that means having even more mobility in her back.
I don't golf now, I don't bowl now, I can't stand. I'm real anxious to have the surgery tomorrow.
It's important to point out, because Kathy's part of a clinical trial,
I think this is going to fit pretty well.
she will not know if her implant is the new design or the older version. She has more than a 50-50 chance of getting the new disc.
As part of the clinical trial, she has to be kept blinded as to which disc it is in order to make sure that her responses to questions about how she's doing are really independent of what the implant is.
One thing's for sure, she's ready for the pain to end.
Hopefully I'll be Wonder Woman when I get out.
Within a few hours, her damaged disc was out, and the new one was in.
New technology is great, but we don't want to use it just for the sake of new technology. We want to make sure that it's advancing the care of patients and really is better.
Kathy noticed changes within the first day.
And it worked, and if you would have told me the night and day difference, I would have never believed you.
So when we met with her nearly 2 months post-surgery, her high heels said it all.
Being able to stand, wear high heels, which, I mean, sleep on my stomach, just these things that I wasn't doing. I was hopeful, but it's like I stepped back 10 years and it worked.
Kathy's experience is going to be added to those of some 300 other patients to determine which disc may help future patients the most. If the FDA approves it, this new disc could be available in about 3 years. This medical trial is still accepting patients, so for more information you can go to our website, thedenverchannel.com, and click on Staying Healthy.